Hello, my name is Dr. Kristen Gumper, and I am presenting Biomarkers of Chronic Pancreatitis, a systematic literature review, on behalf of Dr. Zubeida Cruz Monserrate and the Consortium for the Study of Chronic Pancreatitis, Diabetes, and Pancreatic Cancer. Chronic pancreatitis is the end stage of a progressive inflammatory syndrome that is diagnosed typically at late stages due to morphological features. The diagnosis of chronic pancreatitis, however, is limited by a lack of availability of a pathologic gold standard and a poor understanding of the pathogenesis of the disease. Therefore, the development of diagnostic biomarkers of chronic pancreatitis could create the opportunity to test the effectiveness of current chronic pancreatitis therapies. Therefore, this project systematically reviewed the promising candidate biomarkers of chronic pancreatitis that have previously been described in the literature and evaluated the stage of biomarker development following the probe design method. With our comprehensive systematic literature, we identified articles distinguishing chronic pancreatitis from non-pancreas disease. We focused on biomarkers that were collected from non-invasively or minimally invasively biological fluids. And we compared the effect of each of these potential biomarkers based on the area under the receiver operating characteristic curves as indicated on the bottom right. When not available, we calculated the AUROCs based on the presented data in the paper. We found that all of the studies fell onto the phase 1 of the probe design as indicated in this flowchart here, where phase 1 is preclinical exploratory studies. None of the studies have reached the phase 2 or clinical assay development for clinical disease. Within the literature, we did identify 81 individual potential biomarkers. Of these, 5 had a large effect, 30 had a moderate effect, 31 had a modest effect, and 15 had no apparent effect. Of the 5 that had largest effect in being a potential biomarker, we identified adenosine, diacetoalbumin, oxidative fatty acids, adiponectin, and IL-6 as potential biomarkers. Overall, the chronic pancreatitis research community is still in the early stages of developing biomarkers for the clinical use in detecting chronic pancreatitis early. Validating biomarkers previously identified as having a moderate to large effect using the probe study design will bring us closer to developing clinical biomarkers for CP. The NIH-sponsored PROCEED study within the CPDPC is currently collecting longitudinal biospecimens from patients with known or suspected chronic pancreatitis and non-pancreas disease controls to further enhance our ability to validate potential biomarkers of chronic pancreatitis. We would like to thank our co-authors and our funding agencies, the NCI and NIDDK. Thank you.